Most of the health issues we struggle with daily stem from chronic inflammation. Moreover, conditions related to inflammation are the leading cause of deaths worldwide and represent the greatest risk to human health. It is crucial to counter this issue by adopting a diet rich in anti-inflammatory components. Today, I will present the principles of such a diet, describe its components, and explain how they can support our health. Initially, I would like to share information about a product that stands out among the available options due to its anti-inflammatory properties. I wonder if any of you have already guessed which product it is. According to specialized sources, turmeric has the highest anti-inflammatory potential. There is no other food or single ingredient that matches turmeric in terms of anti-inflammatory action. Regularly incorporating turmeric into our diet, whether in its fresh, dried, or supplement form, is an essential element in enriching the diet with anti-inflammatory properties. However, before I delve into other dietary elements with similar properties and list those that may exacerbate inflammation and should be avoided, I want to emphasize why it's so important to follow an anti-inflammatory diet. First and foremost, we must be aware that chronic inflammation present in our body is the foundation for many diseases. This includes both conditions that we directly associate with inflammation, such as rheumatoid arthritis, inflammatory bowel diseases, or atopic dermatitis, as well as diseases that may not seem related to inflammation. Among the less obvious are various types of cancers, thyroid problems including Hashimoto's disease, coronary artery disease, stroke, neurodegenerative diseases such as Alzheimer's or Parkinson's, diabetes, chronic kidney failure, or fatty liver disease. Referring to the preliminary remarks, each year over 30 million people worldwide pass away due to diseases associated with inflammation. This represents a significant health problem that we face globally. Many of us are at risk of developing chronic inflammation due to numerous risk factors in our environment. These factors include exposure to polluted air, UV radiation, tobacco smoke, stress, harmful substances in food, as well as insufficient sleep quality, lack of physical activity, overweight, or obesity. All these elements can contribute to the development of inflammation, which can be effectively combated by adopting an appropriate anti-inflammatory diet. One of the key arguments for following such a diet is its ability to protect against various diseases. Additionally, this diet can alleviate symptoms of existing conditions, acting not only preventatively but also therapeutically. The anti-inflammatory diet also has a positive impact on slowing down aging processes, allowing us to maintain health for longer. Furthermore, it's important to emphasize that chronic inflammation developing in our body often does not produce clear symptoms, making it invisible until more serious health problems arise, making it a kind of silent killer. Implementing an anti-inflammatory diet in our lives introduces a type of defense in the body, preventing the spread of inflammation. There are certain symptoms that often occur with chronic inflammation, such as constant fatigue, joint and muscle pain, mood swings, susceptibility to infections, and gastrointestinal issues. Knowing the harm of chronic inflammation and the benefits of an anti-inflammatory diet, it is worth focusing on products and ingredients that effectively help reduce inflammation. Interestingly, right behind turmeric, in second place in terms of anti-inflammatory properties, is dietary fiber. Recent research findings confirm that a diet rich in fiber, especially that derived from cereal products like bran, oat and barley flakes, brown rice, and whole grain rye bread, lowers the level of pro-inflammatory factors in the body. Therefore, fiber can protect against cardiovascular diseases, which also develop on the basis of chronic inflammation. Studies have shown that dietary fiber plays an important role in preventing the development of inflammatory bowel diseases, such as Crohn's disease. Additionally, fiber can aid in achieving disease remission, which means alleviating its symptoms. The significance of fiber in an anti-inflammatory diet is multifaceted, but it is crucial that it is regularly present in our diet, especially in the form of whole grain cereal products. Next, it's important to focus on polyphenols, which act as powerful antioxidants and are sometimes called vitamin P due to their significant health benefits. Among the many compounds belonging to this group are anthocyanins, quercetin, resveratrol, catechins, hesperidin, and phenolic acids. It's important to know which foods are rich in polyphenols and thus possess anti-inflammatory properties. Such products mainly include loose-leaf tea, cocoa, dark chocolate, coffee, and various fruits like blueberries, strawberries, raspberries, black chokeberries, cherries, pomegranates, cranberries, citrus fruits, as well as certain vegetables like red cabbage, broccoli, kale, and asparagus. In fourth place in the ranking of ingredients with strong anti-inflammatory properties is beta-carotene. Beta-carotene, part of the carotenoid family, like the previously mentioned polyphenols, exhibits strong antioxidant activity. This is crucial in neutralizing free radicals, which, like inflammatory processes, contribute to the development of many diseases. In a study conducted in 2021, it was found that individuals suffering from osteoarthritis, who had high levels of beta-carotene in their bodies, experienced less intense inflammation compared to individuals with low levels of this component. To increase the level of beta-carotene in the body, it is recommended to regularly consume products rich in this ingredient, such as carrots, carrot juice, pumpkin, red bell peppers, sweet potatoes, kale, broccoli, apricots, and mangoes. In fifth place among ingredients that support the fight against inflammatory conditions are products rich in magnesium. Conclusions from two comprehensive reviews of scientific studies from 2014 and 2022 unequivocally indicate the effectiveness of high magnesium intake, both from diet and supplements, in reducing levels of C-reactive protein, CRP. Elevated CRP levels are an indicator of chronic inflammation. In one of these reviews, the authors clearly noted that magnesium can prevent chronic diseases, among other things, by inhibiting inflammatory processes. In other words, magnesium acts like a shield that protects our body from developing diseases. To ensure an adequate amount of magnesium, it's beneficial to enrich the diet with specific products. Among the recommended sources of magnesium are primarily mineral waters with a high content of this element. In addition to mineral water, magnesium can also be found in products such as barley and buckwheat groats, brown rice, sourdough whole grain rye bread, as well as in almonds, Brazil nuts, cashews, flax seeds, chia seeds, pumpkin seeds, sunflower seeds, white beans, and cocoa. Another valuable ingredient in the anti-inflammatory diet is ginger. Scientific research conducted in recent years clearly shows that regular consumption of ginger can effectively reduce systemic inflammation. Experts have proven that ginger not only lowers the CRP level. Studies conducted by French scientists have shown that regular consumption of ginger can significantly contribute to reducing joint pain in people suffering from osteoarthritis. Ginger, due to its anti-inflammatory properties, can provide relief to many other individuals, especially those who struggle with various metabolic disorders that are accompanied by inflammation. Among the ingredients with strong anti-inflammatory properties, vitamin D ranks 7th. It is the vitamin that most effectively soothes inflammation among all vitamins. Scientific research confirms that vitamin D supplementation can significantly reduce chronic inflammation in people with various conditions. For example, Australian scientists discovered that vitamin D lowers inflammation markers in patients suffering from heart failure. Other studies have found that vitamin D reduces low-grade chronic inflammation in people with type 2 diabetes, and British researchers have shown that it can alleviate inflammation in individuals with inflammatory bowel diseases. Recent studies from 2023 have shown that taking vitamin D at a dose of 4,000 international units per day for 3 months reduced inflammation in individuals with osteoarthritis and contributed to alleviating symptoms of the disease, including joint pain. In light of this data, vitamin D appears as a key component in combating inflammation. The dose of vitamin D should be individually adjusted, depending on the level of the vitamin in the body. In cases of severe deficiency, higher doses on the order of 6,000 to 10,000 units per day are recommended, while for individuals with a normal level of vitamin D, about 4,000 units per day are usually sufficient. In 8th place in the ranking of substances with anti-inflammatory potential are omega-3 fatty acids. According to the results of extensive scientific research from 2022, omega-3s have the ability to reduce levels of various inflammatory markers, including not only C-reactive protein but also interleukin-6 and tumor necrosis factor alpha. Analyses have proven that consuming high amounts of omega-3 can effectively reduce inflammation in individuals with cardiovascular diseases and type 2 diabetes. Moreover, more recent studies from the last 2 years confirm that omega-3 fatty acids lower the level of inflammatory mediators and alleviate the progression of many diseases associated with inflammation. Such diseases include, among others, rheumatic conditions, osteoarthritis, and periodontitis. Thanks to these properties, omega-3 fatty acids are a valuable component of a diet that supports the fight against inflammation. Vitamin E, also known as the vitamin of youth, occupies the 10th position in the ranking of substances with anti-inflammatory action. It has the ability to lower levels of CRP and interleukin-6, which contributes to the reduction of inflammatory processes in the body. It is found in high concentrations in immune cells, making it one of the key elements regulating the functioning of the immune system, strengthening immunity precisely through its anti-inflammatory properties. Excellent sources of vitamin E include wheat germ oil, sunflower seeds, almonds, and hazelnut oil. Garlic, occupying the 11th place, also demonstrates effective anti-inflammatory action. Studies have confirmed that it can alleviate inflammation in individuals suffering from rheumatoid arthritis, reducing joint pain, tenderness, and swelling, which significantly improves the quality of life of patients. Garlic, with its strong anti-inflammatory properties, can be considered as a support in the pharmacological treatment of various metabolic diseases. It is a valuable element of the anti-inflammatory diet, and its regular consumption can contribute to the reduction of inflammation in the body. Surprisingly, vitamin B6 also ranks among substances with strong anti-inflammatory effects. Research indicates a link between low levels of this vitamin and the development of diseases based on chronic inflammation, such as rheumatoid arthritis and inflammatory bowel diseases. Taking high doses of vitamin B6, around 100 mg per day, may bring particular benefits to individuals struggling with these types of diseases by lowering the levels of inflammatory markers. To ensure an adequate intake of vitamin B6, it is recommended to enrich the diet with fatty fish, whole grain products, walnuts and hazelnuts, and occasionally stewed liver. At the end of the list of the most effective anti-inflammatory ingredients is food rich in zinc. A deficiency of this micronutrient can intensify inflammatory reactions in the body and contribute to the development of chronic inflammatory states, negatively affecting the course of inflammatory-based diseases. Therefore, regular dietary intake of zinc is crucial for maintaining an appropriate level of health and preventing the development of inflammatory conditions. Providing the body with adequate amounts of zinc is crucial for alleviating inflammation, as confirmed by numerous scientific studies. To increase the level of zinc in the diet, it's beneficial to consume lean beef, goose meat, turkey, lamb, as well as oysters and shrimp. Plant-based products, such as pumpkin and sunflower seeds, sesame seeds, cashews, and legume seeds, chickpeas, lentils, white beans, are also rich in this micronutrient. In the context of an anti-inflammatory diet, in addition to including the mentioned products in the menu, it is also important to avoid foods that may promote the onset of inflammation. It is particularly important to limit the consumption of highly processed products and those rich in sugars, as well as refined cereal products, for example, from white wheat flour, white rice, corn grits, and highly processed meats. Chronic inflammation poses a serious threat to health, and adopting an anti-inflammatory diet can be an effective tool in combating this problem. I encourage you to enrich your daily diet with anti-inflammatory products and limit the consumption of those that may contribute to the development of inflammatory conditions. Thank you for your attention. Don't forget to subscribe to my channel. The subscribe button can be found under each video. And I invite you to continue exploring the topic of healthy eating and ways to maintain good body condition.